All right, well, thanks everybody for joining us. We'll go ahead and kick things off. I'll hand it on over to you over there in Billings, Mr. Nelson.
Well, good afternoon, everyone. Thank you for joining us in person. As you can see, we have a socially distanced crowd with us today here in the beautiful Montana State University of Billings. Thanks for joining us here, and thank you for joining us out there in Zoom land. Especially a hearty thank you to our legislators. Those of you taking a little bit of time from your busy schedule to talk to us and help us understand what's going on and stay connected. As Dan said, I'm Mike Nelson. I'm the chairman of the Billings Chamber of Commerce Board of Directors, and I'm also owner and operator of the fabulous Northern Hotel in beautiful downtown Billings, Montana. And it is a beautiful day here too, by the way. As we normally do with these video conferences, we'll take the first half of the meeting. We're going to throw it to our legislators in Helena. We'd like a brief update on what it is you guys are doing, what life is like there, and maybe some of the behind the scenes info on some of these bills. But before I give up the microphone, I'd like to mention this has been a really great week for business in Helena, with a few of the governor's bills making their legislative debut. And it should be no surprise that a number of the governor's bills are aligned with our Billings Chamber of Commerce's priorities and agenda. Aligning, of course, with our priority of workforce development, House Bill 252 will create a tax credit for businesses paying for trade education and training for employees. And as an employer, I'm grateful for that. Our tax reform priority, reducing the cost of doing business in Montana, is going to be helped by House Bill 303, which doubles the business equipment tax exemption and is anticipated to eliminate business equipment tax payment by 4,000 small businesses. If that doesn't help commerce, I don't know what will. But rounding out the hat trick of alignment with the Billings Chamber's priorities is a focus on public safety. The governor's Healing and Ending Addiction Through Recovery and Treatment Fund makes available about $23 million to amplify substance abuse and treatment programs carried out by local nonprofits. The Heart Fund is included with the budget bill, and we're really happy to see that. Well, hey, we greatly appreciate the governor and the bill sponsors for their work on these issues and encourage support from our local legislators. With that, I'll turn the microphone over to everyone in Helena to get us started.
Thanks, Mike. And it looks like we've got 3 legislators so far, all in the House. So we're going to get a very House-centric perspective here. We'll go ahead and start off with folks we have in the room, and Representative Kathy Kelker.
Thank you, Dan. Can you hear me all right on your end?
Yes, we can.
Good. Okay. Well, I'll just hit the highlights on some bills that will affect Billings and Yellowstone County. We have a bill that's about to be passed out of the House Judiciary, and it was originally carried by Bill Mercer, who is not with us today, but I'm very familiar with the bill. Scott Twido came and gave us a really good understanding of what's going on with DUIs in Yellowstone County. And the concern that he brought to us was folks who have numerous DUIs, and it's apparently a fairly small group of people across the whole state. And they're wanting to do some things that will get those people into treatment. And the recommendation was to increase the penalties for a 5th DUI and anything subsequent after 5th, and also to pursue treatment for those individuals who are found guilty of this crime. In general, the legislature has been trying not to fill up our jails and prisons, but in the case of someone who is over and over and over again having a DUI, it's important to get those folks off the street, of course. They shouldn't be driving, and to see if you can get them into treatment. So I think that one's going to go well. Excuse me. And then we have had a bill recently that has to do with our municipal courts. As you probably know, municipal courts in our larger cities in Montana are overwhelmed with cases, and they don't always have enough time with their judges to get through all the hearings and so forth. So what the bigger cities have been doing is using an assistant who is not an elected official, but who can handle hearings and that kind of thing. The bill that was brought to us was from Senator Chris Friedel, who used to be on our council in Billings. And he wanted to get rid of these part-time people and only have people who are elected as municipal judges. And we're trying to work on a compromise because the cities have come in, and I'd love to hear from people in Billings on this topic if they have some information. There isn't always enough money to handle all of the things that go with an elected judge, and it's cheaper to have these half-time people that are helping with the overload of work. And not, so I have an amendment that I'm putting on the bill that's coming from the League of Cities and Towns, and I think it will be a good compromise. We'll see. Then I want to warn you about next week. Next week, we're going to have the death penalty bill. Every year since I've been in the legislature, the death penalty has come up. And you may have read or heard in the media that there was a bill last week that had to do with the medications that are used in the death penalty. So that bill that is still pending. And the second one will be to repeal the death penalty. And I'm sure there will be a lot of people coming to speak on that topic. So if that's of interest to you, next week is the week, and you can testify remotely, and it's not hard to do. The only thing that's tricky is that you have to sign up 24 hours in advance because they make a list of all the people who are going to speak and try to parcel it out so we can get as many people in as possible who want to speak. So get ready for that one. It's a perennial, difficult set of questions that come with the death penalty, but very interesting. So that's enough for now, and I have others if we have more time.
Thank you, Representative. Casey, I see your hands raised, and that's kind of a reminder. We'll make it through sort of this legislative update here real quick, and then we'll open it up for a Q&A from folks that are attending both in the room at MSU and via Zoom. So please be thinking about those questions as they come up. So we'll go with Representative Custer.
Thank you and good afternoon. My committees, it's not quite as exciting as Kathy's committee, but anyway, or Representative Kelker, I should say. But yesterday in energy, we did pass out to look at nuclear energy again in the state because it's things have changed in that arena. So we passed that bill out, and we also passed a bill out of energy yesterday that will give the state library some money out of the 911 funds to help get the counties and up to speed on their 911 enhanced the things they need to do for that. Because there are 7 big counties that have GIS departments that are kind of partway there. And according to the testimony, even those counties are only like 49% effectively getting ready for the enhanced 911, which is when your cell phone goes off, they can find you not by pinging off 3 towers, but just find your cell phone. So there's a lot of work that has to be done on that. And of course, with that, there's addresses that are constantly changing. So the bigger areas like the Bozeman Flathead, where people are moving in and out quickly, it's hard to keep up with your address changes, even if you do have a GIS department. So some money to the library to help with that. And the rest of the counties are way behind in this aspect, and some haven't even hardly started. So that will help that. And then in my local government committee, we've been seeing a lot of bills, of course, on public health, like trying to take all the public health things that have been done away and have the local governing board have to kind of look over everything. And so now some of those bills that came through are back in, I believe it's in the Business and Labor Committee to be put together to make one bill out of them for the public health and the the emergency government powers. But we still have some bills in our committee that deal with public health, like now it's sanitation. And it's probably a constituent bill the way I read it, but they want to have the governing powers look over all the sanitation regulations. And it's like, they're set by the state. And if you don't go stronger than that, you shouldn't have to have somebody look at them because they're pretty straightforward. So, but we have those kind of bills going. And then apparently there must be something going on in Billings with the county water district and between the county water district and the city. And so we have a bill that I consider constituent bill on that. So we got to deal with that as well. So we're trying to gather more information before we go forward on that. And I guess that's kind of what I've got going on in my committees as far as legislation that may affect you. Oh, and we did pass the bill that the chamber called on about inclusionary zoning that kind of puts a little hamper on that. So we passed that out. I voted no because I'm about local control, but just so you know, it's out on the floor, or it'll be out on the floor.
Thank you, Representative. We'll switch over to Zoom. We've got Representative Karjala with us.
Dan, so you just want me to run through the bills that I have in my in the committee where I'm the vice chair?
Whatever you'd like to share about things that you're working on, or just general issues you'd like folks back home to be aware of.
Sure. Well, we're going to be voting on several bills in House Human Services today. House Bill 37 just eases up the eligibility for home and community-based service waivers that provides services to people with disabilities like a home habilitation aid, some durable medical equipment. This is a good bill. House Bill 274 establishes that applied behavior analysis is a service available to families who have children who are at risk of abuse and neglect. House Bill 275 establishes that the appropriation of money for developmental disability services cannot be moved. So basically it's just saying that money that's appropriated within the Department of Health and Human Services can't be moved from where it was appropriated. It's just basically codifying the will of the legislature. And the last one is a bill that allows more insurance coverage for diabetes self-management care. This is critical for folks who have diabetes in order to not only know how to self-administer their medication, but how to use some of the equipment that they might have. That about covers it for my committee. The bill that I was most attached to died. You can all feel sorry for me now. I'm working on a bill to appropriate more grant funding for suicide prevention for veteran service members and their families, and for the Native Youth Suicide Review. And then I'm also hoping to get the bill passed that I got over into the Senate last year, which just basically bans lunch shaming. If you have questions about bills that are upcoming in my committees, I'd be glad to answer those. I think you all have my contact information. If you don't, feel free to ask and I'll give that to you.
Thank you, Representative. And we've got one more that's joined us here, Representative Bill Mercer.
Hi, Dan. How are you? Good. I've got the green light on. Sure. So is the question, what am I carrying, or what's hot, or what do you want me to talk about? Oh, thank you. I'll cross that off the list. So I think it's interesting how quickly things can change, because I think maybe if we didn't say it last time we were together, I think we were feeling it, which is things were moving very slowly. The bills that we were seeing on the floor tended to be, very in the larger scheme of things, not probably a lot of 100-0 votes, a lot of 95-5 votes, not, certainly there are days where we had contentious and closely fought bills, but they were few and far between. And I think we may have said when we were together last time that we were all somewhat concerned about just the pace because there weren't that many bills. It seemed like the bills were all kind of stuck and they weren't coming out. And I looked last night and all of a sudden we have like 400 House bills introduced. We went from like 200 to 400 in a very short amount of time. And, with the transmittal deadline coming up, we got push a lot of stuff through the Python. And so it's going to be I think a pretty intense next couple of weeks. I guess I first want to say that I'm trying this session to pick up a piece or two of things that I wasn't successful getting across the line 2 years ago. And then I've added another bill, all that I would put in the category of transparency in government, accountability in government, sunshine in government. I view these as good government bills that regardless of where one is philosophically, particularly if you're in the legislative branch, we have a vested interest in understanding what the executive is doing. So last time I had a bill vetoed that required disclosure of all pending litigation and all settlements. Senator Esp and I are coming back with that bill. We'll have our first hearing in Judiciary on that bill next week. And it is in large part what we did before. We tried to address a few of the things that were in the governor's veto message, but I'm excited about that because I think that we've had a lot of litigation resolved through non-disclosure agreements, which means by definition, the public is unable to tell what's going on. And as a legislature, we have no idea what is coming through the courts that might result in substantial payouts from the state to resolve litigation, and this would give us some optics into that. Representative Custer is on the State Administration Committee. We had what I thought was a really fun hearing, might be my favorite hearing since I've been in the legislature, where I was in with House Bill 277, which is a Government Performance and Results Act, which can be summarized as sort of a strategic planning requirement that every executive branch agency would need a strategic plan, and every agency would need to have performance measures that they would be trying to meet, hit various goals, quantitative where possible, and that we would have a greater understanding of what agencies are hoping to accomplish. And it was a fun hearing, and we'll see where the bill goes. I've just signed a rebuttal to the fiscal note, which I know you'll be shocked was quite high, I thought. We will see where all that goes. But the shorthand there, I think, for anyone in the private sector, and frankly, for many of us that have been in the government sector, I found when I was a government manager that it was hard to know at the beginning of whatever the relevant period was, how will we know whether we've been successful? And it's easier in some contexts than others, but in some contexts it's hard. But if you don't have the conversation, you certainly can't assume that you're going to end up where you should end up. Last year, as a freshman, when I was on the Appropriations Committee, I asked most of the executive branch agencies that were coming before us on the general government side if they had strategic plans, and to an entity, they said no. So during the interim, I worked to try to figure out what other states had done, and I think this is a really important bill, and it's been fun to work on. And then one that's actually on the floor today is another frustration as a legislator, but that I think everyone's heard the term fiscal notes. Anytime a bill is going to require an expenditure, the governor's budget office creates a fiscal note. And there's a term up here called death by fiscal note, which is if you hang a big enough number on it, it probably is something that ultimately the appropriators will say, well, we can't afford it. And so I said in the interim to the Legislative Fiscal Division, hey, can you tell me how much ended up being spent by the executive branch in fiscal year 20 on these bills, not every bill, but I had 8 bills that I wanted to have them tell me what we'd spent the money on. And they came back and they said, well, we can't tell you that. I said, you can't tell me that. I mean, you told me how much it was going to cost. You can't tell me how much you actually spent. No, we don't have a way of tracking that. So the bill on the floor today will say for bills with fiscal notes in any of the 4 fiscal years that would have a general fund expenditure in excess of $1 million in any one year, that the budget office will have to report to the legislature on what the expenditures have been for the 4 fiscal years. We'll get a report every year. And again, it's just transparency. It's an understanding of what's being spent on what we've decided to legislate. And most importantly, it's going to give us a sense of whether the numbers that they put on the paper actually bear any resemblance in terms of what it's actually going to cost. So the Department of Transportation said today that to do the strategic planning work, to implement the strategic planning bill, it was going to cost $500,000 in the initial year. So people say things that I don't think really can be substantiated. So I've got some other bills, but I'll get to them if people have questions. Those are the things that fit into the sunshine, transparency, good government bucket.
I have a question, Bill.
Well, yeah, a little unorthodox, but sure, we'll have a question from a legislator to a legislator.
Thank you. Thank you for indulging me. I think you forgot that I also serve on state administration, and we agreed that we would talk about House Bill 277. I particularly wanted to discuss qualitative versus quantitative outcomes with you. Yeah, so I'll be reaching out to you, I guess. Thank you.
All right, thank you. Well, that rounds out our kind of legislator update. So we'll open it up to Q&A from folks back home. And I haven't forgot you, Mr. Casey Williams. So I don't think I have to unmute you. I think you can do that yourself. Go ahead and ask your question.
Well, it's too late. My question was going to be to the list the bills that they were talking about. When we were talking about some of the bills, it was nice to have the House bill number associated with it, but we're through with that now, so everything is wonderful. Thank you.
You're welcome. Thanks. Who else? Any burning questions right off the bat? Oh, all right, Becky.
Thanks, Dan. Can you hear me?
We can hear you. You're good.
Great. Thanks so much for your time. I have 2 things. First, just a comment. I want to reiterate Mr. Nelson's gratitude for the HART funding that is currently in the governor's bill. We, as part of Substance Abuse Connect, I think a lot of you folks know that I project manage that currently, had some say in that. And it's really nice to see that kind of funding come through. So to the degree that you can support that, we would appreciate that. And then secondly, and not necessarily related to that, we're seeing a lot of bills come through around local health boards and health officers, a whole bevy of them. I'm particularly interested in knowing if what your thoughts are on HB 121, which is Beatty's bill around that. I realize it's hard to pull one bill out of that. So in lieu of that specific bill, if you have thoughts on just those bills as kind of a package, I'd be interested in hearing that. Thank you, Dan.
Thanks, Becky. We'll start with Representative Kelker.
Thank you. And my colleague right next to me will have something to say too, because the bills have gone mostly to judiciary and local government, and now they're in business and labor. But 121, Representative Beatty's bill is, in my opinion, the most reasonable bill. There's 2 concerns that we're hearing about. One is that the businesses, not everywhere in the state, but some places in the state, felt as though they had no say in how the pandemic was handled and the requirements that were put on businesses in order for them to be open part-time or with distances and so on. I keep bragging about Billings, however. I think there was a great connection between the chamber and the folks working through the health issues, and a big effort in trying to help small businesses do what they could do to be successful during the pandemic. But that wasn't apparently the way things happened everywhere. to be fair. So there's that concern. And then there's the concern that that decisions in an emergency should be made by people who are elected, as opposed to the board members, the health board members, who are appointed to their board jobs. And the health officer is hired by that board. And it's different from one county to another, exactly how the board is made up and who appoints and all that sort of thing. So I think it's reasonable for us to look back on the pandemic now that things are getting slightly better, but let's not give up on all the things we should be doing too soon. And I think Beatty's bill is trying very hard to balance the needs. Some, in my opinion, some of the other bills are much more, sort of banning the public health folks and not realizing how much good work that they have done for us and their organizational abilities and so on. So we have had 3 major bills come through judiciary, and the ones that we've had have now gone on to business and labor, where the plan is to pull them all together and pick out the good parts and have a bill eventually. So turned over to local government and see what you've experienced.
Yes, thank you. I was on state admin, and we had one of the emergency powers for the governor bill went through that committee. And then on local government, I've had 2 bills, one we tabled and one we passed out, which she was talking about, the Beatty bill. And that was for the public health, the powers of the public health during a pandemic. And we amended it to be so that the only time the public health would be looked at maybe by the county commissioners, and it's not even, it doesn't even have to be, we put the word may in there, in case they would have enough on the emergency regulations, if they had enough pushback, say from the businesses or whoever that felt like they were being harmed, that there could be a public hearing, and then maybe they could overrule on some of them or come to another consensus on the rules. And so that's where that one stands. But then there was one that went through judiciary, as Representative Kelker said, so that they were kind of similar. So they're going to try to take the 2 bills and put them and make one bill and, make it as best they can. But the one bill that got tabled that dealt with the public health powers is the person wanted to make every single thing public health did be looked at by the governing body. And probably not in, he was thinking that was a good idea, but in these rural counties, the county commissioners don't meet every day like they do in Yellowstone County. So say you have an issue with E. coli at the restaurant in my county, well, not in my county, they meet every day too. But in some of the counties, people could be dying before the county commissioners meet and say yes or no on whether they can enforce the rule. So that was totally, they wanted the public health to do the work, but yet they couldn't do the enforcement. So that's not the purpose of public health. And I don't think that was the general intent. I think people were just got disgusted with the pandemic lasting so long and some of the rules, and they were going out of business. And I can rightfully say, if you're losing your business because you can't have people come in, you're definitely going to be upset. So that's why we knew something was going to come out of this, to have to take care of a pandemic situation. And so we tried to make it the best we can and let the public health still have do what they do best in the name of science, and only let the commissioners deal with it when there's an issue that's affecting a lot of the members of the public in some harmful way. So that's kind of where we were at with those bills.
Yeah, it shows how hot an issue it is when we all have, even though we're on very different committees, we all have touched this in one way or the other. I actually, just to complicate things, I've got a 3rd bill. It's House Bill 316, which deals with both emergency powers and the public health officer, and it's going to be heard Friday. So it's another flavor on the bills that Kathy and Jerry have already talked about. I would say, Becky, that to really kind of understand. I think of the governor's emergency powers and the powers on public health boards and public health officers much the same way. I want a system that is really nimble, because I think what we've learned here is we can't really anticipate what sort of emergencies might arise. So I don't personally believe that the emergency authority that the governor had in statute was very broad. And one of the things my bill does that is different than the other emergency power bills is it is more explicit in terms of extending the governor's power. On the other hand, we were potted plants basically for the entirety. As legislators, we had no role whatsoever in what was going on. And you can imagine there's broad-based concern that we need a system where emergency authority exists in the executive branch, whether that's at the local level or whether that's at the state level. But then there has to come a point where there's effectively an appeal mechanism. And so these bills all are trying to say, we want after a certain point to revisit whatever has been done. We want, in the case of the local public health board or the public health officer, if there is a citizen that believes the exercise of that emergency authority was not prudent, my bill would essentially say after 30 days, a citizen could take an appeal to the county commissioners. In the case of the emergency power for the governor, I have a mechanism that says after 30 days, any one legislator could ask for a poll as to whether those emergency authorities should be continued. So I think I agree with what Jerry said. We knew coming in here, and I think we talked about this on some of the chamber calls in November, December. There's no question that the majority in both the House and the Senate were pretty concerned about how much authority was vested in individual county public health officers. And I hope the debate continues to remain sort of focused on how much power there should be that's unreviewable, because I think what we're doing is not intended to say this public health officer did something wrong or this public health officer should have done something different. It's to create a mechanism that says at the end of the day, the county commissioners, if there is a sense in the community, they are in a position to say whether they think something should be continued or not. And I'm not at all surprised that these bills are moving, and I agree with what both Kathy and Jerry said. There's going to be a committee bill or a single bill that comes out of House Business and Labor and will come to the floor. And it will be an amalgamation of these 3+ bills that are out there.
Thank you, Representative. And so yours is House Bill 316, and correct me if I'm wrong, but Representative Beatty's bill is House Bill 121. Okay, for those who want to track those at home. And I just wanted to quickly echo what Representative Kelker said about our model of cooperation and information sharing in Yellowstone County between our public health and the Billings Chamber and Big Sky Economic Development and a host of other businesses was a great model, but it was an exception, not the rule. After having chatted with a number of other chambers around the state, they really had a lot of difficulty in dealing with their public health boards. So while we had a great situation for our local community, a number of these bills have been pushbacks to some negative circumstances in others. I see that we have, it looks like Mr. Kukulski there on the Billings end. Mr. Kukulski.
Yeah, thanks, Chris Kukulski, City of Billings. So just wanted to provide an update on a bill that's still yet to come, but it is being worked on. So it's LC 3268. LC 3268. Some of you have been helping us directly on it. So I just want to thank Representative Terry Moore, who's actually going to carry the bill, Representative Usher, Representative Kelker, Representative Mercer, amongst others who are helping us on it. Basically, the gist, and it's at the drawing board right now. Amy Gromelas, Greg Dorrington are there, and Helena working with the writers. The purpose of the bill, or the essence of the bill, will be that if and when, based on track record, when a prisoner who has fully been adjudicated through the court process, and my apologies for not using the right technical terms, but once they've been fully run through the judicial process and it's determined that they are in fact the state's custody, so to speak, if they have not been moved out of a county jail or a local jail by the 5th day after that adjudication, then the Department of Corrections needs to provide an explanation to the court as to what the status of that individual is. So the whole idea there, pretty simple, is to try to put some pressure on the state, candidly, to move their folks to their facilities and out of local facilities. Here in Yellowstone County, I think pre-pandemic, the number was somewhere around 80 individuals were pretty much permanently or extended stays at the local Yellowstone County jail. And during the pandemic, I think the number is closer to 130. That has made life very difficult for law enforcement at the local level. So that's coming soon to you guys. So thank you for your help on that and just kind of an update. Thank you.
I'd just like to comment that we have had some very good discussions about public safety in general for Billings. And there is a sense that we get more than our share of folks re-entering the community from prison in Billings. And that's partly because we have more services than other places in the state. And so somehow we have to start working our way through that process. And one of the first steps is this getting people out of our local jail that are already adjudicated. That's a great start in the right direction. But there's a lot of other things that we're going to need to do, and to have a relationship with the state that's positive, that we're deciding who's responsible for what, because not everybody who needs services is going to be able to be served in Billings. In many cases, we are really strung out pretty far dealing with what we have. So we're starting first steps, and I think we can get farther along the way in the next couple of years.
Thank you, Representative. All right, I don't see any other hands, so I'm going to take the liberty and ask a question myself. You brought up the county water districts issue, and this is something that I'm just starting to kind of learn about, but has already had some impacts for especially businesses and business growth in the Heights. And maybe I can lean on, we've got Ms. Jennifer Owen on here as well, if she wanted to fill in and lend a little bit of information and insight as well. But Representative Custer, if you've got any additional information there on how that could impact businesses, particularly in the Billings Heights and other areas as well.
Well, what brought to the forefront that there must be a problem is we had like a bill from a representative from Billings that brought a bill trying to deal with like the water rates and things like that. So then there was a whole bunch of testimony on it. So apparently there's been some things maybe going on, or else the people that are doing the testimony don't understand how it works. So I didn't know why we needed the bill personally, because the law on county water districts to me is very clear. And everything that I was hearing for testimony is things that could be done with training, like open meeting law, agendas, elections, the whole business. And then and as far as the engineering and the fee setting, there's trade organizations out there for water districts that could help with that as well if there was an issue. So I felt like we didn't need the bill. They just need some help, some input, some professional input from, surrounding water districts or the organizations that run water districts. So the bill's still in the works and people are amending it. It's like, because maybe we don't need it, but I don't know if how it's going to come out. But we're trying to make it so it's not too egregious, because everything's in code and it doesn't change it for everybody else that's doing a good job. So I see it as I don't know, it's kind of a city-county thing, and then it probably grew, it was needed, and then the city grew, and they could take it, but then it's gonna cost maybe more money, and there's a whole bunch of issues there that I don't know that we want to get into as law people, because if we change the county water law, it affects every little tiny district in the state, and there's a tons of them. So that's kind of where I was at. So there's more to the story that I didn't know about when we had the hearing, and if I would have been more aware that there was an issue, probably would have made the people stick more to what the issue is and not just complaining, because it was like, we're not the board here. We're here to make law for everybody, not a specific constituent bill.
Thank you. And I see we've got Ms. Owen has turned on her camera. Maybe she can help provide some more facts or uncross my cross wires here.
Yeah, I think I'm not completely in agreement with that characterization of the bill. I think what Representative Brewster has indicated is that in the course of exploring this issue, he's discovered that there are other communities that are struggling with county water districts as well. So I'm not sure it's entirely just a Billings Heights issue. What I can say from our perspective in the Heights is what was said is absolutely correct. There is law that addresses this, but when the law isn't being followed, ratepayers really have no recourse. And I think what Representative Brewster is trying to do, rightly in my opinion, is ensure that there is remedy, that there is a way to address this issue. It really is in the Billings area hitting a fever point as we are seeing increasingly development being delayed. There is a significant investment of resources being made in creating a bypass over the Yellowstone River into the Heights. And that opens up new land for development. The uncertainty and ambiguity of the county water district in serving that area, or perhaps prohibiting development due to unfair rate making, undisclosed fees, and an uncertain process, is a significant economic problem. And it appears that that is happening in other communities around the states as well. So I think the question is not whether or not there's adequate law, but whether or not there's adequate remedy when the law is consistently not being followed. And to be clear, what we're seeing here in Billings, and I think what's being seen in other states, is this is not innocent or unintentional error. Of course, that's something that can be remedied through training. What we're seeing is a consistent pattern of intentionally failing to follow laws, everything ranging from rate making and rate studies to open meetings and public notice. So I think it's a pretty significant concern. I think it's shared around the state, and it's certainly something that we hope the legislators would take a serious look at.
Thanks for that input. That helps a lot.
I'm happy to continue talking about this. It is a point of passion for me.
All right. Well, thank you for that extra input there. I've got one, another, unless there's anybody else that has questions, I'll keep going here. We had a member reach out, Representative Karjala, to ask about, I believe it's the one you just talked about, your insurance for diabetes, folks with diabetes. They had asked, I didn't have a whole lot of details, but I was able to give them the information to watch the hearing. Can you go over that just a little bit in case we do have some others interested in that bill and that information?
Thanks, Dan. Yeah, heartbreaking bill. Almost 800 emails were sent to each committee member supporting the bill. There were a lot of people that were pretty passionate about passing the bill. It was a somewhat unfortunate bill hearing because I had reached out to the insurance companies back in December, both to Blue Cross Blue Shield and Pacific Source, both of whom would be most impacted by the bill. I was told by Blue Cross Blue Shield that they would probably come in as informational witnesses. I really didn't hear back from Pacific Source too much other than a question that they gave me. So I was a little bit surprised when they came in so strongly against the bill. I could understand opposition to the bill. Certainly, you know, what this issue boils down to is pharmaceutical pricing. When it comes to a pharmaceutical drug where people's lives are being impacted, when it's something that they need to stay alive, people get pretty passionate about it. But anybody who knows anything about how pharmaceutical pricing is determined, you know that it gets pretty technical between what goes into patenting, researching, developing, advertising from the manufacturers end to the pharmacy benefit managers who negotiate contracts. They're middleman, for lack of a better description. They negotiate prices on behalf of, between the insurance companies or whomever else might be buying in bulk, a self-insured plan, and the manufacturers. They take a discount or rebate. And then you have the people on the insurance side of it, of course, who end up paying the bills. And the insurance company's argument was that this would end up raising premiums. There were studies that proved that it had a de minimis effect, is what they called it, where depending on where the cap fell, it would only raise premiums by $1 per year. Long-term study done by the state of California, which would be considered a neutral party, showed that like the same argument for Medicaid expansion, for any type of preventive health care, is that if you have people taking care of their health, they don't have the adverse health outcomes that they might have otherwise. So they don't have kidney failure, they don't have cardiovascular disease, any of the other myriad complications that result from not taking their insulin, diabetic ketoacidosis, which puts people into the emergency room, which is a very costly event. So you hear about uncompensated care. When we talk about health care, people who have disabilities often have co-occurring disorders. One of the major co-occurring disorders is diabetes. So those costs are absolutely being passed along to us. So it makes sense that over the long term, it would lower healthcare costs. I certainly understand the insurance companies' fears that it would increase their premiums, but it was unfortunate. And I've reached out to both of the insurance companies since then to make sure that they know that there was no adversarial intent. But if you watch the bill hearing, it was probably one of the more difficult bill hearings that I've been a part of. And I'm sad about that. I'm mostly sad that the people who desperately need affordable insulin weren't able to get it. But the diabetes educators are committed to continuing to work to bring insulin prices down. And I hope that we can all continue to work with them to make that happen.
Thank you. Yeah, appreciate you sharing that. And remind me, is that House Bill 222? What was the number on that? In case people want to go back and watch.
House Bill 222. Thanks, Dan.
Excellent. All right. Well, unless we have any other burning questions, I know our legislators have to get down and get ready for the floor session. I want to say thanks to everybody for joining us, in particular our legislators, but folks back home and on the Zoom call. And I'd like to say a thank you to our sponsors, MSU Billings, helping to provide those lunches in the space back home, as well as the City of Billings, Big Sky Economic Development, and the Downtown Billings Alliance. We'll have this in 2 weeks, not next Thursday, but the Thursday after from noon to 1. And we hope to see you all there. Thanks, everybody.